Welcome to this second lecture on the cranial nerves. So this is going to cover the nerves 7 to 12. Again, like the first lecture, the take-home message is to understand the course of the nerve, where the nerve starts, where the nerve ends, whether the nerve is sensory, motor or both, and structures that it innervates. So starting with this image here, I know it looks a bit complicated to start with, but I'll walk you through it. The first nerve that we're going to cover in this video is going to be cranial nerve number 7. Okay, so that is the facial nerve. The facial nerve is a mixed nerve, so it's going to have both motor and sensory components to it. So starting, now remember, like the other videos, sensory will come from the face or the head or neck and go into the brainstem, whereas motor will go out to it. So when I talk about where it is in the brainstem, that just is referring to either sensory coming in or motor coming out. So I'll start with so we're in the pons region. So we're going to be in the kind of the pontine medullary junction, but most correctly say in the lower pons. So start with the blue. The blue is going to be motor. So we're talking about the motor component of the facial nerve to begin with. So this is going to be the this is going to be the pharyngeal arch component. So to be correct, this is going to be called special visceral efferent, and this refers to the pharyngeal arches. So we've got the own nucleus for this. It will come and transverse on its own, where it goes through a foramen known as the internal acoustic meatus. Okay, and then it will descend down, come in close proximity to the middle ear, where it gives its first motor branch, and that's going to innervate what we call the stapedius. So that's the stapedius muscle, which is going to go into the stapes and dull down the amount of sound waves going through the stapedius. So that's going to help dull really loud sounds. Then we're going to go through, and we go through another foramen. So we're in the skull still. We go through another foramen. This is called the stylomastoid foramen. So it's right at the back here, the mastoid process, styloid process, in between that. So it's going to pop out, and it gives a few branches early on. So it gives a branch, which is going to be the occipital belly of the fronto-occipital muscle. So the muscle that goes over to help crinkle and help the back. So it's going to do the occipital part. The second branch is going to go to the posterior belly. So posterior belly of digastric. Digastric. Di means two, gastric bellies. Okay, so gastric, two bellies. Posterior belly digastric. Anterior belly digastric comes from the trigeminal nerve. Then we go in to the parotid. This is the big parotid duct, the big parotid gland here, which is for saliva. It goes into it, where it branches out to 5 main branches. 1, 2, 3, 4, 5. The way I remember it is 2 Zanzibar by motor car. So it's going to be a temporal. Branch 1 is temporal. Branch 2 zygomatic. Branch 3 buccal. Branch 4 mandibular, and branch 5 cervical. So they're going to innervate a whole lot of muscles. Remember, these muscles are the muscles of facial expression. So the temporal is going to do the frontalis. So we saw the occipital part of the frontalis, occipula frontalis. So it's going to do the frontalis part. Zygomatic is going to help innervate the eye, orbicular oculi, so the one that goes around your eye to help it close. Buccal will help you do the buccinator. So if you were to blow a cheek like this, that is the buccinator. So that's from the buccal. The mandibular is going to do the depressors of the mouth. So mentalis and the depressors to bring your mouth down, that is the mandibular, and cervical is plantaris. So the one that goes like that is from the cervical branch. So that is the motor branch. Next one, we'll just do general sensory. So this would be general somatic afferent, GSA. This is going to go in, but a bit different here. The next 3 nerves together is collectively called the nervus intermedius. which is just a selective, a separate branch of the facial nerve. So it's coming off. It also goes through the acoustic meatus, the internal acoustic meatus, and it comes down more closely associated with the motor branch, where it's going to bring sensory information from the external acoustic meatus. So that's the outer ear canal. All right, so that's the second branch. The third branch, this one here, so this is green, this is going to be for taste. So this is also sensory, so it's going back into there. Okay, so this is going to be general visceral afferent. Okay, so it's going to bring taste from the anterior 2/3 of the tongue and the palate. So these two branches here, which I'll come to the red in a second, so these two nerves together are joined, and that's going to be called the chordae tympanae. Okay, and in terms of the anterior 2/3 of the tongue, this is taste. It's going to come back at the chordae tympanae, go up, and then synapse in that part of the pons, whereas the taste from the top palate is going to go back and join it kind of here, just another side of the internal acoustic meatus, and then join down here. So finally we're left with the parasympathetic. Okay, so this is going to be general visceral efferent. So this is parasympathetic fibers, and it's going to go through as the nervus intermedius, like the other three branches. Three branches in total, going through the internal acoustic meatus, where this one will drop down as the chordae tympanae nerve now, where it's going to end on the submandibular ganglion. So this is a ganglion here where it synapses, so that's going to be pre-ganglionic fibers where it synapses, and the post-ganglionic is going to be carried by the lingual nerve in the trigeminal. So this is going to go and do salivation, and this one here is going to go up, and these nerves collectively up here are known as the greater petrosal nerve. Okay, and in this case it's going to go to the pterygopalatine ganglion, bring in preganglionic fibers here, where it's going to go on. Okay, and that's going to help with lacrimation. They're the main branches of the facial nerve. So we've seen that it has a parasympathetic fibers, it has visceral fibers which bring in taste, it's got general sensation just to the ear, and it's got those motor fibers which we went through. So that's the facial nerve, and you can see now how it's mixed. It has all those components to it. The next one along, it's much easier. So this is cranial nerve number 8. Okay, this is what we call vestibulocochlear nerve. So in its name, it should tell you what it's doing. So it's going to be a special sensory nerve. Okay, it's coming from, so it starts at the pons. So this one's much easier because it's only one. So I'll put start and I'll put end. All right. So it's going to, well, technically it's originated in the cochlea and in the vestibular apparatus, and it goes and ends in the pons. So I should actually correct that and say it ends in the pons. So it's going to start in the cochlea and in the vestibular apparatus. So that's where it originates. So the cochlea is for hearing, and then up here we've got the semicircular canal. So semicircular canal and utricle, and the bottom branch is saccule. Now, there's going to be an upper and lower fibers of the vestibular part, and the cochlear part is bringing back cochlea. It too will go through a foramen, which is called, same as the foramen up here, the internal acoustic meatus, where it goes back and then synapses and ends in the pons. Okay, so that's the cranial nerve number 8, vestibulocochlear. It's pretty straightforward. All it does is brings in special sensation for hearing and movement of the head, movement, acceleration, side to side, forward, back, through the semicircular canals and the utricle and the saccule, and that will go through internal acoustic meatus. It's in this area, it's in the temporal bone, and then it goes back into the pons. Which leaves us to the next nerve. This one's a bit harder than the 8th. This is the cranial nerve number 9. This is what we call glossopharyngeal. And again, the name should help you here to tell you what it does. Okay, like the facial, it has many components to it. Actually, it has the same kind of components. So it's going to have a motor, it's going to have a general sensory, it's going to have a type for taste, okay, or other special sensation, and then it's going to have a parasympathetic component. So let's start with the blue, which is going to be for motor. So this particular part is for the pharyngeal arch. So the blue is branchial motor, which is branchial arch. So this particular segment is the 3rd pharyngeal arch, and it's only going to go to one muscle. So it's pretty easy to remember. So this is going to be special visceral efferent. Now the only confusion point here is the 9th and vagus 10th have the same nuclei, and that's the nucleus ambiguus, if you remember in the brainstem lecture. So that nucleus here in the pons, this nucleus here in the medulla is in the nucleus ambiguus. So it's going to run, they're all together, but I'll just start with the motor. It's going to run and go through the anterior part of the jugular foramen, where it comes and descends down. And it's going to synapse and innervate the stylopharyngeus. Okay, so that's the only muscle that it innervates. So that one is pretty straightforward. In terms of the general sensation, it's going to go through, so this is actually going backwards, but I'll just go in this direction. So it's going to go through the anterior portion again of the jugular foramen, and you're going to have this one that will run closer proximity to this top branch, and so it's going to be in the temporal bone, so near the ear, and this is going to innervate the middle ear, so sensation to the middle ear. Okay. Now the other 2 branches that go down, so you've got another sensory branch that's going to pick up sensation from the tonsils, and this other one which is going close to the tongue, and so it's going to bring just purely sensory information here, so that's going to be touch, pain, temperature to the posterior 1/3 of the tongue and the pharynx. Okay, so that's going to be just general sensation. Then we have the special visceral sensation. So this is going to be like the taste here. So this is going to be general visceral afferent. The black one was general somatic afferent. So this is going to bring information. Taste, it's close to this one. Taste to the posterior 1/3 of the tongue. Okay, but it's also going down to the arch of the aorta and also the carotid sinus, so it's going to bring chemoreception and baroreception. So that's for blood pressure and that's for chemoreception coming up to the brainstem, to the midbrain, to the medulla. And then finally we're left with the parasympathetic. So the parasympathetic here, so this is going to be general visceral efferent. So this parasympathetic, it's going to go again through the anterior portion of the jugular foramen, but this is going to have its own special nerve. It's a tympanic branch, and this is going to be, unlike the greater petrosal nerve, this is going to be the lesser petrosal, okay, where it comes through the foramen ovale. So it has to go through the foramen ovale, which comes out of the skull now, and it's going to synapse here, and this is going to be in the parotid gland. So this is going to be called the otic ganglion. Okay, so that's preganglionic fibres, and this is also for saliva, so to the parotid gland, and so it needs to be carried. Another branch needs to carry postganglionic fibres, and that's going to be the auriculotemporal of the trigeminal, which is similar to over here, which is the submandibular, which it carried preganglionic, but the trigeminal lingual nerve carried the postganglionic. So that's 7, 8, 9. Now we'll move on to cranial nerve 10, 11, 12. All right, so now moving on to the last 3 cranial nerves. Here we've got number 10, so this is cranial nerve 10, which you all know is the vagus. Now the vagus, as you can tell by the colours, is going to be mixed because it's got a whole lot of sensory and motor. So it is a mixed nerve, and depending on how you look at it, whether it's sensory or motor will determine where it's coming from or going. But generally speaking, it's going to be in the central nervous system side, going to be in the medulla, and it's going to go down as far as the transverse, kind of the splenic flexure of your transverse colon, and all the proximal structures of your GIT, including your, then moving up to your heart and your lungs and so forth, pharynx, and then doing some of the bitter taste and so forth. So let's go through those. We'll do one bit at a time. So start with the red. The red is going to be parasympathetic. So this is going to be a general visceral efferent. Okay, so it's taking motor signals, visceral motor signals down to the lower structures. So the vagus meaning the wandering nerve, the vagabond nerve, so it's going to travel quite a distance compared to the others. So it's going to come out of the medulla, and it's going to travel through the jugular foramen, okay, at about the middle part of the jugular foramen, and descend down, and then we're going to synapse in like the cardiac plexus, and that it's going to go to the heart, it's going to go to the bronchioles, and it's going to go to the GIT. And so they're going to do, slow down the heart, cause bronchoconstriction in the GIT, help with secretion, help with peristalsis, etc. Whilst we're there, so we're going to take sensory back up. So this is going to be in the green. So we're going to originate, at least from the green's point of view, coming up, bringing sensation from the viscera on the GIT, the heart, the lungs, etc. So we're going to bring sensation back up, and it's going to meet some more sensation here in green, which is going to come back and meet it here, and that's going to go back up through the jugular foramen where it synapses here on the tractus solitaris, okay? And this is going to be general visceral afferent, okay? So down here it's just bringing visceral afferent, visceral sensory up from the GIT, heart, lungs, etc. But over here it's going to bring taste right behind the tongue, so the vallecula of the tongue. So that's right on the posterior aspect of the tongue. It's going to bring taste from there as well. In terms of just general sensation, okay, so this is just general somatic afferent sensation. It's going to bring, whilst we're here, I'm going to call this nerve here, so this nerve collectively is called the recurrent laryngeal nerve, okay, and whilst this one here collectively is called the superior laryngeal nerve, okay. So in the recurrent laryngeal, this is going to be sensory information below the vocal cords. So any sensory, so that's touch, pain, etc., below the vocal cords is going to be brought in by the recurrent laryngeal nerve, whereas anything above in the larynx, above the vocal cords, it's going to be brought in by this nerve. It's going to go in the superior laryngeal nerve. Now, it's important to just be aware that this particular branch of the superior laryngeal nerve is the internal branch. Okay, so it's going to go back through, pierce that membrane, the thyroid membrane, go through here, meet up with this one so the recurrent and superior laryngeal. Now it's just the general vagus, going back into the brainstem, and that's your general somatic afferent. So that's left with the last one, which is the motor part, and this is branchial motor. So this is going to be special visceral afferent, taking motor from the pharyngeal arch 4 and 6. Now it's important to know that this is coming from the nucleus ambiguus, so it's going to be bringing motor signals out on the way down. But it's also going to meet from the nucleus ambiguus a motor signal from cranial nerve number 11, which we'll cover in a second. So that actually merges together, and that will then give you a collective motor branch. In terms of the first branch goes off, this is going to go off and supply a whole lot of muscles, but this is what we call the pharyngeal branch. And that's going to innervate muscles such as the salpinga pharyngeus, the palatopharyngeus, the palatoglossal, go to some of the constrictors, go to the top part of the esophagus, the striated esophagus. So that's coming from that branch. Whereas further, as we go down, another branch will go in the superior laryngeal nerve, okay, and that's going to go out and supply. That's going to be the external branch. So that's the external branch, external, and this is internal here. External branch of the superior laryngeal is going to go to only one muscle, and that's the cricothyroid. Cricothyroid. Okay, so it's important to know the superior laryngeal does branch into one external branch, which is motor, and then the internal branch, which goes through the thyroid membrane to give you sensation, vocal cords, and that taste coming from the vallecula. And then finally, the last bit of the motor is going to come down in the recurrent laryngeal, and that's going to innervate all those intrinsic laryngeal muscles. So they're all the muscles that will help move the vocal cords. And so from that you can see the basic components of the vagus. Moving across now to cranial nerve 11. So this is the accessory. It's got two parts to it. It's got the spinal accessory and the cranial accessory. So the spinal accessory, as you can see, comes out at levels C1, C2, C3, C4, C5. They merge as rootlets and go into one, where they pass through, so they're actually going up. So they're going up, upwards, through the foramen magnum, up they go, and then they come and meet the cranial portion of the accessory nerve, and together they go through the jugular foramen, and at least this component, which is going to be, I should have written this in, this component is going to be general somatic efferent, so skeletal muscles, going up through there, meeting up with the collective accessory nerve, but then going down and branching off to supply the sternocleidomastoid, okay, and the trapezius. So the trapezius helps you shrug, and that's how you test it, and the SEM helps you turn your neck or lateral flex. Whereas the cranial portion comes from the nucleus ambiguus, which is going to be special visceral efferent, and those coalesce together, come through the jugular foramen, meet the spinal accessory, but then go off and branch and meet up with the vagus. Okay, so they meet the vagus, which we actually saw there. And that's essentially the accessory nerve. So the accessory nerve is generally considered a motor nerve, or is considered a motor nerve. Has two components to it. It has one that kind of from the nucleus ambiguus, and the other one is coming from just general somatic motor, which is coming from the cervical regions. Which finally we finish off with the hypoglossal nerve. So this is cranial nerve number 12. Okay, this is also completely motor, and it should tell you in its name that it's hypoglossal, which means it's going to the tongue. So this has got all these little, approximately 20 little rootlets coming out, which coalesce again to form the collective nerve. It goes through the hypoglossal canal, and it actually meets fibers coming from C1 up. Okay, so it's coming from the ansa cervicalis coming up, and that meets it, and they continue on. It gives two branches to the strap muscles in the front of the neck. Those strap muscles are thyrohyoid and geniohyoid. And then finally, the last distal branches will go to the intrinsic tongue, genioglossus, and styloglossus. They're the distal branches that's going to be innervating. So that's moving the tongue. And so essentially to test this cranial nerve, the hypoglossal nerve, you just get the patient to move their tongue. And if there's issues there, then the nerve might be the problem. So that leaves us with the end of the cranial nerves. That's the 12 cranial nerves. So now hopefully you've understood that where they start, where they finish, what they innervate, and a general course in as they move through the head and neck.